Right now, as you sit watching this video, your heart might be under attack. And the worst part, you probably have no idea it's happening. Hello, my friend. I'm Dr. Victor Hanford. For over 30 years, I've worked with patients just like you. And I've seen something heartbreaking happen again and again. Good people, careful people, who take their medications and see their doctors regularly, still end up in my office with serious heart problems. Why? Because they're making small mistakes every single day. Mistakes that slowly damage the heart, mistakes their own doctors never warned them about. Today, I'm going to share 7 of these hidden heart dangers with you. These aren't the obvious ones like smoking or eating too much salt. No, these are the sneaky habits that fly under the radar, and by the end of this video, you'll know exactly how to fix each one. You'll have a clear action plan to protect your heart starting today. But please, you must stay until the end, because habit number 1 is the most dangerous of all. It's something almost every senior does without thinking, and it's sending thousands of people to the hospital every single year. So, let's not waste another moment. Your heart deserves better. Habit number 7, drinking too little water. Let me tell you about George. He was 72 years old when he came to see me. George felt tired all the time. His legs were swollen. He thought it was just old age, but when I asked him a simple question, everything became clear. I said, "George, how much water do you drink every day?" He looked at me and said, "Maybe 2 glasses, maybe." Here's what most people don't understand. When you don't drink enough water, your blood becomes thicker. Think of it like honey instead of milk. Your heart has to work much harder to pump that thick blood through your body. Day after day, month after month, this extra work wears your heart down. And here's the tricky part. As we get older, we stop feeling thirsty. Our body's alarm system stops working properly. So, we think we're fine, but inside, we're slowly drying out. The fix is simple. Drink 6 to 8 glasses of water every day. Keep a water bottle with you. Take a sip every time you see it. Don't wait until you feel thirsty. By then, you're already dehydrated. Habit number 6, sitting for hours without moving. Now let's talk about sitting. You might think, what's wrong with sitting? I'm resting. I'm being careful. But here's the truth. When you sit for more than 1 hour without moving, your blood starts to pool in your legs. Your circulation slows down, and your heart, once again, has to work harder to keep everything flowing. There's a study from the American Heart Association. They followed 10,000 seniors for 5 years. The ones who sat for more than 8 hours a day had twice the risk of heart problems, twice the risk, just from sitting. I know what you're thinking, but doctor, my knees hurt. I can't go for long walks, and I hear you. I'm not asking you to run a marathon. I'm asking you to stand up every 30 minutes. Walk to the kitchen, do a gentle stretch. Even just standing for 2 minutes helps. Your heart will thank you. Remember, we're getting closer to that number 1 habit. The one that's causing the most damage. Stay with me. Habit number 5, skipping breakfast. Here's something that surprises most people. Skipping breakfast is terrible for your heart. I had a patient named Dorothy. She was 68. Every morning, she would just have coffee. She wasn't hungry, she said, but by lunchtime, she was starving. She would eat a huge meal, and then feel exhausted all afternoon. When you skip breakfast, your body goes into stress mode. It releases hormones that raise your blood pressure and your blood sugar. Your heart rate goes up. Everything gets tense. And if you do this every single day for years, you're putting constant strain on your heart. A study from Harvard followed 27,000 men for 16 years. The men who skipped breakfast had a 27% higher risk of heart attack. 27% from missing 1 meal. The solution: eat something within 1 hour of waking up. It doesn't have to be fancy. A bowl of oatmeal, a banana with peanut butter, 2 eggs. Just give your body fuel to start the day calmly. Habit number 4, taking hot showers for too long. This one shocks people. But listen carefully. Very hot showers can stress your heart. When you stand under hot water for 15 or 20 minutes, your blood vessels expand. Your blood pressure can drop suddenly, and your heart has to race to keep up. For a young person, this isn't a big deal. But if you're over 60, especially if you already have heart issues, this can be dangerous. I'm not saying you can't enjoy a warm shower, but keep the water warm, not scalding hot, and keep your showers under 10 minutes. If you feel dizzy or lightheaded, sit down immediately. Don't take chances. Habit number 3, not managing stress. Stress is a silent killer, and here's what makes it worse for seniors. Many of you are dealing with stress that younger people can't even imagine. Losing friends, health problems, worrying about money, feeling lonely. When you're stressed, your body releases a hormone called cortisol. Think of cortisol as your body's alarm system. It's good in short bursts, but when that alarm never turns off, it damages your heart. It raises your blood pressure. It makes your arteries stiff. It increases inflammation everywhere. The answer isn't to avoid stress completely. That's impossible. The answer is to have a daily practice that calms you down. For some people, it's prayer. For others, it's deep breathing for 5 minutes. Maybe it's calling a friend. Maybe it's sitting outside in the sun. Find something that works for you and do it every single day. We're almost at number 1. The habit that's hurting more hearts than anything else. Don't click away now. Habit number 2, neglecting your gums. This sounds strange, doesn't it? What do my gums have to do with my heart? Everything. When you have gum disease, you have infection in your mouth. That infection causes inflammation, and that inflammation travels through your bloodstream straight to your heart. It damages the lining of your arteries. It makes blood clots more likely. Studies show that people with gum disease are almost twice as likely to have heart disease. Twice as likely. Brush your teeth twice a day. Floss once a day. See your dentist every 6 months. It's not just about keeping your teeth. It's about keeping your heart healthy. Habit number 1, not getting enough sleep. And here we are. The number 1 heart-damaging habit, not sleeping enough. I know. You might be thinking, but doctor, I can't sleep. I wake up 3 times a night. I understand, but this is so important that we have to fix it. When you sleep less than 6 hours a night, your body never gets a chance to repair itself. Your blood pressure stays high. Your stress hormones stay high. Inflammation builds up. And over time, your heart pays the price. A major study followed 75,000 people. The ones sleeping less than 6 hours had a 48% higher risk of heart disease. Almost half. So, what can you do? First, go to bed at the same time every night. Turn off the television 1 hour before bed. Make your room dark and cool. If you need to urinate at night, don't drink water after 7 p.m. And talk to your doctor about safe sleep aids if nothing else works. My dear friend, we've covered a lot today. 7 habits. 7 changes you can start making right now. I want you to know something. It's never too late. I don't care if you're 60 or 70 or 85. Your body still wants to heal. Your heart still wants to get stronger. But it needs your help. You are not a burden. You are not too old. You matter. And every small step you take matters. Pick 1 habit from this list, just 1. Start there. And I promise you, you will feel the difference. Thank you for trusting me with your time today. Until next time, take care of that beautiful heart of yours.